Welcome back to another episode of the Health Dialogue by Bangkok Hospital, Phuket. I'm Nicole Bravata from Tanyapura, and together with me today is Morgan Quinchon, our Manager of Nutrition at Tanyapura, and we are pleased to be here with Professor Art Hiranyakas, who is the Director of Bangkok Hospital, Phuket Colorectal Disease Institute, and also the Director of Colorectal Surgery Clinic at Bangkok Hospital Headquarters in Bangkok, as well as the governor of the International College of Surgeons in Chicago, USA, and president of the American College of Surgeons Thailand chapter. Today, we're going to talk to you about ways to keep your colon healthy and cancer-free, and a little bit more in depth about how our immune system functions. This is something that I think a lot of us are really interested in. Of course, in the situation with COVID, everybody's wondering how they can keep themselves well and have a really strong and robust immune system. So here to tell us more about that today is Professor Art. So please let us know, Professor Art, what is the immune system, and how are some of the ways that we can keep ourselves healthy?
Thank you. Thanks for your kind introduction. Thanks, Nikki. And we are trying to move the slides and then to show you how important the immunity is really. So if we talked about immunity, we are talking about how us as human getting away from those pathogen bacteria nowadays divided into two major groups. The first one is the pathogen that could harm us, causing diseases and so on. The other groups is, of course, we're going to be touching a little bit at the end of the sessions about probiotic, which are the good group of the bacteria. So if we talked about how to defend our body from those pathogen, bad bacteria, there are many ways that the nature has built for us, and that could be simplified by two systems: the innate system and then the adaptive system. The innate system is somewhat that we had since we were born. So it could be divided into physical, chemical, complement, or inflammation. Make it simple. Physical is like the skin or mucus layer on the other organs, like respiratory tract or GI tract, for instance. And chemicals is like the acid in the stomach that could kill the majority of the bad bacteria when we accidentally or unintentionally taking them. And then we move to complements and inflammation. We have to know that the innate system for the immunity is not specific. It's like the general barrier or defenses mechanism for our body. So those inflammation and complements are there to protect the other pathogen that could enter the physical, could pass through the physical and chemical barrier that I mentioned earlier. And these are the combination of cells that would come together to destroy the bad bacteria. And another system that I mentioned earlier is the adaptive system. To make it short and simplify, the adaptive system is actually the system that's more specific. We're talking about helper T cells, cytotoxic T cells, or even B cells. Those are the cells that would be more specific, that they can produce antibody to the specific antigen to target specific bad things that would come to our body. Bad things, not just bacterial fungal infection, but cancer cells as well would be destroyed by this adaptive and more specific kind of system of immunity. So this system is very, very clever. So it's good that we have this system so we can stay healthy and away from the diseases, especially the infections.
And then there's some things that we can do that we can actually take charge of our health, right? Of course, it's great that we have this system already in place, but there's some things that could hinder the way that it functions, right? And so we actually have to be advocates for our own health and take care of ourselves in ways that we can protect or help this system, right? I mean,
Yes.
we know talk about the immune system would be complete without talking about sleep, for example, right? Sleep being
Definitely.
one of the things that can really impact how our immune system functions. It's one of the things that we often scrimp on. We kind of are getting used to these fast-paced lifestyles, and we think, oh, we can sleep less and do more, but actually that can really hinder our immune system. They show in studies that if you sleep less than 7 hours, you're 3 times more likely to catch a common cold or a virus. So adults would need around 8 hours of sleep, maybe give or take about 30 minutes either way, but kids needing even more than that. So even up to 10, 11 hours sometimes. So, and we can't discredit, that the amount that we sleep needing to be in a certain time period, maybe from about 10 until, 6 in the morning or so for a full 8 hours, and avoiding interruptions. One of the things that can really interrupt sleep that we see a lot is alcohol. People like to maybe have that drink before bed, and they feel like maybe it helps them to fall asleep. But the problem with alcohol is that it fragments sleep, actually, so it can impair the quality of your sleep. So that's one of the things that also can be a big issue right in the gut and how it affects the microbiome. So alcohol should really be eliminated even out of it's obviously some people feel that it has some benefits to it, like some resveratrol or some polyphenols and things, but we can get those from other sources. We can get them in our diet, so it's better to look for them in other places. Smoking is another one. We obviously know the effects of smoking can be very dampening to the immune system. We don't have to spend too much time on that. It interferes with the lining of the lung and how we can protect ourselves from respiratory diseases, of course, and is a risk for all types of diseases. So avoiding those, but there's other types of toxins that can be a problem too. And so this is one of the things that we can take control of, is to avoid things in our environment that can be bringing us toxins, things that maybe we don't think about, like our body products that we put on that can be full of toxins. You read the labels and we can't even pronounce the names. So we should be avoiding these types of toxins, even certain plastics that can, dysregulate the the hormonal function. So try to avoid drinking out of plastic bottles or heating in plastic items. Even heavy metals in our environment, we can find these in conventional foods. So trying to choose organic foods can be really helpful to avoid just exposure to extra toxins, because they create free radicals in the body. They create a lot of inflammation, and our immune system has to respond to that. So these are things that we can take into control, not to mention stress. So don't let all this information stress you, but adding something like meditation, some form of relaxation can be really helpful, even just 5 minutes a day, to take a moment. Here we are in Thailand, where this is something that's very, very usual here, to take a break for samadhi, for relaxation, for meditation. This can be very beneficial to reduce inflammation in the body, reduce inflammation in the gut even. And when we talk about stress, we have to talk about exercise, because there's so many great benefits for our immune system to exercise. But it's one of the things that we see commonly in Tanyapura, where we see a lot of athletes, is overtraining. So there's really a sweet spot when it comes to training too, that, we can get that benefit for the immune system. We know that it will have an effect on the innate system, the adaptive system. There's so many great effects, but overtraining can be another source of stress for your body too. So we have to be really careful about that, and having an assessment to find out how is the balance in your body before you begin your exercise routine can be really beneficial, so that we can make the right type of recommendation about what type of exercise can be very helpful. And then, of course, we have to consider nutrient deficiencies. This is one of the things that really can be helpful. And I think one of the things that people think about the most when they talk about improving the immune system is, what can I take? Is there some certain supplements that we can take? But we can find a lot of these in food. And so that's right, Morgan, right? We can find a lot of these. Yes. Can you tell us, Morgan, a little bit more about what are some of the things that we can find in food that are going to help us have a better immune system?
Sure, thank you. When it comes to immunity, we need to understand that 70% of our immune cells are created in our gut. So if you want your immune system to be functioning properly, you really need to nourish yourself and take care of your gut, because that's going to be the first defense line. So in terms of digestive system and digestive health, the first thing that comes in mind is fibers. We need to eat enough fibers in our diet. And what is fibers? Basically, it's vegetables and fruits, or plant-based food, right? And nowadays, with ultra-processed food, the diet and the food that we choose and that we find are completely depleted with fibers. And it's also because we are human and we go with the routine, we kind of basically always eat the same food. So the same type of breakfast, the same lunch, the same dinner. And then we don't have diversity or like enough fibers type in our diet, because I'm sure everyone hears about you need to eat 5 veggies and fruits per day. And now the latest studies show that for gut health and immunity, it's actually 30 different variety of plants per week. So when we talk about plants, it's vegetables, fruits, mushrooms, whole grains. So it's a big nuts and seeds. So I think all of us, like the 3 of us, we can start and calculate how many types of nuts, seeds, and fibers we get per week. If we can reach 30, which is not easy, we might already boost our gut, therefore boosting our immunity. And as Nikki said, there is a lot of supplements that people think about, like vitamins and minerals. But guess what? We can find them in our diet first. It's true that when we are too deficient, we can have some help from supplements, but you can find them in your diet. So let's start with vitamin C. Vitamin C is the biggest antioxidant, and as Nikki mentioned, stress. When we are stressed, we receive a lot of free radicals, and vitamin C will help to counteract with those free radicals. It's again the biggest antioxidant. And vitamin C can be found in fruits, like citrus fruits is the biggest family we know. And here in Thailand, you have the pomelo. Pomelo is so rich. Pomelo is a superfood. So if you go for a pomelo salad, which is mysai, namtan, and the rest, it is an immunity booster food, right? So vitamin C from citrus fruits, but also berries, like acai berry, which is a really famous berry lately from Brazil. You can do acai bowl, and they are like so rich in vitamin C. So you really want to think fruits for sure, but also dark green veggies that contain vitamin C as well. And when we talk about vitamin C, we need to remember that when we cook it, we lose 0.5% of it at least, because it's really heat sensitive. So you want to make sure that you have enough raw food in your diet to get enough fibers also, because when you cook it, the cooking process can also destroy the fibers, or some vitamins. So vitamin C was the first, but then you have all the fatty vitamin, the fat soluble vitamin, which is like D, A, E, and K. Let's focus on the first 3 ones. Vitamin A is really good for immunity, vitamin D as well, and vitamin E. Vitamin A, you want to think colorful diet, more orange type. So carrots, pumpkin, squash, even mango contains some pro-vitamin A that then will become vitamin A in your, let's say, in yourself, right? Then you have vitamin D. Vitamin D, no matter what your diet is, you can be like, we are all deficient. Even though we are living under the sun and we know that sun can boost, most of us are deficient. And it's also the happiness vitamin. So we kind of, most of us, we need a supplement. So yes, there are food sources, but I will focus on supplement, and maybe once a year. But before supplementation, anyway, you need to see a doctor first, do a blood test or a heavy metals test that we can check your minerals in your skin, just to be sure that you are lacking of it. Otherwise, no need, right? Vitamin E can be found in nuts and seeds, mostly legumes as well, and it's boosting your immunity. And then in terms of minerals, you have selenium, zinc, and iron, in addition to all the other ones, but I would say those 3 are really important. Selenium can be found in the Brazil nuts, and many of our guests, when we see them, we tell, okay, you are low in selenium, just eat 2 Brazil nuts per day and you're covered. So yay. Now everyone goes to the supermarket and finds selenium, Brazil nuts. And zinc can be found in legumes like chickpeas, lentils. It's true that we do not consume those much, but it can be easily added. Like you can add them on a salad, you can add them, you can do a hummus as a dip. So you can consume them more easy than what you think. And finally, iron you can find in many animal products, but also in plants, nuts and seeds, legumes as well. So basically, in terms of diet, you really want to focus more on plants. Why? Because nowadays our diet lacks of all those nutrients, phytonutrients, minerals, vitamins, and fibers, and those are so easily found in plants, way more than in animal products. That's why. And when we talk about plants and all of those magic foods, we need to think of fermented food and all those probiotics that can also then refer to your gut health. And then I will leave it back to you, Professor Art, if you want to talk about probiotics.
Right.
Yeah.
Yeah. So as I mentioned earlier, that there are two types of bacteria. There are good ones and bad ones, right? We talked about bad ones a little bit, but now we return to the good one, probiotics. It's quite a hot topic that I think the majority of the audience or all of us would be aware of the advantages of the probiotic. It would be the variety of them. Believe it or not, bacteria that would live with us since our born is about 100 trillion species of them, so lots of them. And not only the diversity, but the ratio or the ecosystem between them is very important. Because like sometimes the same bacteria, if they stay in a certain amount, it would bring some good health or making some good chemical for our body. But if the ratio of that same bacteria is increased, it could harm and cause some diseases as well. And the bacteria in the colon, in the large intestine in particular, is very important, as it would be fermented or turning some ingredients from the prior gut that would be sending to the large intestine as the last part of the intestine, making stool and then pass it out daily. These bacteria is affecting the whole body. It can make us more productive, and at the same time, it could decrease the incidence of getting diseases, and at the same time as well, it could be affecting a lot on our mood and concentration, and sometimes other diseases related to brain, like Alzheimer's diseases as well. So these are the variety of the effect of having good bacteria in the large intestine. So yeah, for our studies that I'm actually a specialist on colon and rectal surgery diseases, and of course colon cancers as well. So we are trying our best to prevent cancer for all the patients, for everybody here, especially on this island, Phuket, because we have found that the incidence of colon cancer and rectal cancers as well has been increased in the recent years. So how to avoid getting cancer? So we found from our studies that taking fibers, like you just said, we call it non-resistant starch. It's like the starch that would be resisted to be digested through the mouth, through the stomach, through the small intestine, and eventually it would go to the large intestine. That kind of starch would be fermented by the certain type of bacteria in the large intestine, and eventually would turn the fiber or carbohydrate, these kind of carbohydrate, to short chain fatty acid called butyrate. Butyrate is very effective as to prevent the mutation or the changes of the cells in the large intestine, to prevent the polyps, to prevent cancer, or to turn early cancer to be disappeared in the animal study. So these, for instance, these effect of probiotic is very effective as to prevent colon cancer. So what we eat is very important, and we are what we eat, and we can say collectively we are what our bacteria eat. All right.
Yeah.
So that's very important. So I would go quickly to the other topic of how to prevent colon cancer apart from using the probiotic. So there are some recommendations from the World Health Organizations as to recommend everybody to be away from colon cancer. And I think personally, these are not only colon cancer prevention, but the all organs cancer prevention as well. The first thing is the same that the two ladies just mentioned about. Stress is very important. How to reduce stress. Exercises is very important as well. BMI, keep it a standard BMI, not too much as obese and not too low. BMI would be very much affected to colon cancer development, and to be away from taking alcohol. Alcohol consumption is not a good thing. Cut it down or stop it, or even the cigarette should be stopped as well. And if we can do all these things, including taking enough fibers and fruits from vegetable and fruits to get good fibers to your gut, that would be something that we should go for. But in order to get all that done, I think we might need the motivations, and I'm sure these two ladies in Thanyapura can help you to motivate you by giving further information if you're interested, and then go into the course that they have in Thanyapura. That would be definitely helping to assist you as to start to get the healthy life. And last but not least, I would like to inform all of you that screening for colon cancers is one of the strong recommendations as to prevent colon cancer, because colon cancer would start with little polyps, and those are benign. If we leave the polyps for over 10 years, then it would turn to cancer. So get yourself screened. If you're 45 or 50 or above, you should come for screening as some sort. The gold standard would be the colonoscopy. And of course, we are here for you at the Colorectal Disease Institution in Bangkok Hospital, Phuket, the 3rd floor. All right. Yeah. That's it for my part. Thank you.
Thank you, Dr. Art,
Thank you.
and thank you so much, Morgan, too. As Dr. Art mentioned, at Thanyapura, we perform our 360 health checkup, which is more of a lifestyle checkup. So it's looking into those factors like your level of stress and how it affects your health, your sleep, your exercise, finding out the right type of exercise. We're really into sport in Thanyapura, but it can be really important to find out what is the right type of exercise for you. Also, following the right type of nutrition plan along with the screenings offered at Bangkok Hospital, Phuket. There is a great opportunity for you to take your health into your own hands and prevent things like colon cancer or any other type of disease. It's not just colon cancer or any other type of cancer, but we're talking about obesity and heart disease, diabetes. These types of diseases really can fall into the category of lifestyle diseases. So we encourage you to join us in understanding more about your health. See you next time on Health Dialogue with Phuket Hospital, Bangkok Hospital, Phuket. Thank you so much for joining us, and great thank you to Professor Art for joining us. And please let us know if you have any questions or if you'd like to make an appointment. You can contact either Thanyapura or Bangkok Hospital Phuket by reaching out through Facebook or calling our main number. Thank you.
Thank you.
Thank you.